Hello everybody, welcome to my YouTube channel. This is part 2 of the radio questions that I'm answering from my callers, my listeners who tuned in when I was at Baraka FM. And a continuation of this question is, one, what type of food should I eat in pregnancy? During the pregnancy time or period, a woman should eat the balanced diet meals and should eat a lot of greens. This is vegetables, the spinach, chicha, skuma, to be able to boost iron levels in the body, because these are rich foods in iron. And then you'll have what we call the levels of hemoglobin at good levels. So eating well, balanced diets, protein and fruits, a lot of water. This will help the baby grow well and grow in. Yes, to enable the proper growth of the baby, and also for the woman to be healthy in terms of having good HB, that is hemoglobin level, high immunity, and also be fit for delivery when time comes. I'm just answering the question, not talking about the topic. Another question from a lady who was asking about having severe headaches whenever she's in her monthly period, and also severe cramping during this time. Is it okay, or what medication can I use to help or to ease the pain? Having the severe headaches and the severe lower abdominal pains or cramping is common in most women during the monthly period, because it's a time that the uterus is shedding out, and this is what now comes out as the period. And this shedding now causes a lot of pain on the lower abdominal side, and if it is very severe, it is okay to take drugs to ease the pain. Like you can take Buscopan, you can take Panadol to ease the pain, or do the warm bath compression or warm compressions on the lower abdominal side by using a towel or a bottle with warm water to be able to ease the pain. About the severe headaches, it is common, or it is there because you are experiencing these abnormal or changes of hormones in your body. And so there are those who have the severe headaches, there are those who have the low abdominal pains, and there are those who will have different type of moods during this period. So it is all about hormonal changes during the time of period. Another lady also was asking, I have tried to conceive for 2 years and I'm not breastfeeding my 3-year-old daughter, but have not succeeded. What could be the problem? There are some women, when they're breastfeeding, it is very hard for them to get pregnant again, because when you're breastfeeding is a way of method of family planning. The hormones are imbalanced, and so you find that some women who are breastfeeding, it is hard to get to conceive again until when they stop breastfeeding. Some can be up to 2 years, 3 years, or others are different, because they even conceive in the after 2 months, after 3 months, they are already conceiving and they are breastfeeding. So it is about different bodies and different reactions to hormonal changes. So for this lady who has not conceived after 2 years and she's not breastfeeding, she could be having what we are calling subfertility, and this can be addressed by seeing a doctor or a gynae who is going to prescribe fertility drugs for you to be boosted on the low infertility or the subfertility you are going through. And this is something reversible. It's nothing permanent. It can change after the medication. You can conceive again and be able to bear your child or your children as you are planning. So it is good for you, the lady was asking the question, to go and see the gynae or the doctor for them to talk and discuss about this issue so that you can conceive again. Another question that was also addressed to me by somebody was, I am 40 weeks and I have past gone my date of delivery by 5 days. Is it okay? sometimes we always say that a pregnancy should go only 9 months. In counting in terms of weeks, we say 40 weeks, and up to 40 weeks is okay. If labor has not started after 40 weeks or at 40 weeks, it is always good to see your doctor to be able to get help, so that this can be addressed to avoid the complications that follow up after postdatism. And you'll find most after postdate or after postdatism, what you are going to do is get an induction of labor so that labor can start. Okay. Yes, and I was saying, if it is in the case of postdatism, then there is always a necessary action for you to go and see your doctor, so that anything that is abnormal can be detected. Maybe it is the baby who is big and has not been able to go down, that is to engage, or maybe there is some what we call CPD, that is this is about the pelvic not being able to open up for the baby to go in or to engage into the pelvic well enough to be able to go into labor and get to deliver. So there are some problems that can be detected for you to be able to be told if you can deliver normal, or you have to go through the cesarean section because of the postdatism. So it is always good to see your gyna. Maybe you can also do a scan to clarify the size of the baby, the dates again, and all that. Yeah, so yes. Another question was about a lady who was asking, I was done a cesarean section in 2019, and now I am pregnant and due again. Must I go through the cesarean section again, or I can deliver normal? Always the doctors would prefer to engage or to monitor a mother who is a previous scar or has gone the cesarean section previously, to enable to assess if you're good enough or you're in the category that can deliver normal after the cesarean section. That is where we have what is called the TOLAC, or the trial of scar after cesarean section. Sorry for that. So you have to see your gyna or to be monitored closely for you to be assessed to fall in that category of trying the scar or not trying the delivery at all. So, and always it's good after the cesarean section to stay a bit longer than like 2 years or more for you to fall under that category of you can be able to be assessed and given a chance to deliver again in a normal as a normal delivery. And so as a previous scar of 2019, I would say it is quite early for you to try the scar, but it's always good to talk to your gyna or to see your doctor to be assessed and given the proper guidance. And again, mothers who have the previous cesarean section are always considered as high risk, because the previous scar, when you get into labor, it's always a risky process because you can get what we call the uterine rupture, and this can lead to other complications. So it is always good to be guided, to be seen, and always approved for you to deliver normal or not. And once the doctor says that you can deliver normal, it is okay. Just know the indications or the risks involved in this, and then you'll be able to understand and be able to cooperate that you can deliver through the cesarean section again. It doesn't limit the deliveries of somebody if you deliver once through the cesarean section, because I say if you deliver normal or cesarean section, at the end of it all, what you need is a safe mother and a healthy baby. So after the cesarean section, it is always good to be seen, guided, and monitored by a gynecologist. Another lady was asking about what about my skin that has gotten the black pigmentation. This is about the color changes of the skin in pregnancy, because you'll find that most mothers will get darker, very few will get lighter, or most of them will get darker because there is what is called hyperpigmentation. That is, the skin gets more darker because of the changes in the skin in the skin system. So you find that there's always the stretch marks on the abdomen. There is what we call a line which runs from the umbilical cord downwards. This is called the it's a dark line that appears there, and so all this is about the changes that happen during pregnancy. You find that your skin on the face goes darker than normal, and the whole system generally. So it is always a change that is not permanent. It is going to wear out or to come back to normal after delivery. And so don't run after creams and lotions and all that in pregnancy to be able to look brighter. Just give it time. After delivery, your skin is going to come back to normal, and yes, you're going to look as beautiful as you used to be. Another one was asking about I went into labor 2 days ago. I went to the hospital, was seen, and I was told my cervix has not opened up, but I'm still in pain. What do I do? The labor process always has different phases, as I said earlier on. There is the first stage, there is the second, and there is the delivery, and then there is after delivery. So always there is the first stage that can start like 2 days or 3 days prior to going into the active labor, because it starts with the low abdominal pains that are there on and off until the labor now becomes picks up or becomes established, so that the baby has engaged well to go down, and the contractions are adequate for them to bring the baby down to open up the cervix. So it's a whole long process when you're in the latent phase, because you have to go through the latent phase. The baby has to come down, go into the pelvic, open up, and then be able to reach at the cervix point where it's going to open up now the cervix. So it is okay if you're in the latent phase to be told yes, you can rest a bit, observe yourself, and then come back when the labor has picked up or has been established. So guys, I have so many questions to answer. I have prepared just a few for today, and I'm so grateful. If I've answered your questions, it's okay. If I've not answered, I'll always be running this session of the questions that I'm getting from you. I'll be sitting down and talking about them. As we talk about these questions, we are going to be learning more and more. And as I said, I'll only be answering the question and not talking about the whole broad topic. So guys, this is Regina Jonas. Thank you for viewing the video. Thank you for staying with me, and let's move together. Let's learn and grow with Regina Jonas. If you're new here, subscribe to my YouTube channel, support me, and like my videos, share them, and always leave a comment to get me to improve on what you need me to improve. Otherwise, bye bye for now.